Hello, my name is Deirdre Nocton. I am the Director of Midwifery in Portiuncula University Hospital. Congratulations on the birth of your baby. I hope that you enjoyed your pregnancy and birthing experience with us. The following video is to help you to navigate through your postnatal journey. It contains useful information to help you in the first few days and weeks after giving birth.
Hi, my name is Lisa. I am one of the CNMs on the maternity ward. I am briefly going to discuss your length of stay in hospital postnatally and what follow-up you may require. Shortly after the delivery of your baby, you will be transferred to the postnatal ward. Here you will begin to get to know your baby. Your midwife will do daily checks on you and your newborn. They will support you feeding your baby and give you any medication such as pain relief. Your partner can come in from 9 a.m. Please ask your midwife regarding visiting policies as these are continuously updated. On the postnatal ward, we aim to provide individualised care and education so you are prepared for the initial postnatal period. If you've had a normal vaginal delivery, you may be discharged on day 2 if your postnatal journey has been uncomplicated. However, you may need to stay longer if you've had a large blood loss for breastfeeding support or if your baby is in the special care baby unit. If you've had a section, you may be discharged between day 3 and day 5 depending on how you are recovering. On discharge, your midwife will complete forms that will be sent to your public health nurse to inform them of your discharge. You will be followed up in the community by your public health nurse and will be due back to see your GP at 2 weeks and 6 weeks. It is your responsibility to book these appointments. If you've had a complicated birth, your obstetrician may make arrangements for you to come back to a gynae outpatients appointment at approximately 6 weeks. You will receive this appointment in the post if required. We look forward to looking after you and your baby.
Hi, I'm Nuala, Patient Education Midwife here in Portiuncula. Congratulations and well done on the birth of your baby. Whether this is your first baby or you have added to your family, having a new baby is a very special time, but it also brings about change and adjustment. Be kind to yourself and don't be afraid to ask for help from family and friends. Every woman bleeds vaginally after giving birth. The blood loss is called lochia. Bleeding is heavy and bright in the first 2 to 3 days. It will get lighter and darker in colour and usually stops at 2 to 3 weeks postpartum. If bleeding becomes very heavy or foul smelling, you need to speak to your GP or contact the maternity unit. Your uterus or womb contracts and shrinks back to its normal size within the first 2 weeks after having a baby. Your midwife will do a daily check on you and your baby. Perineal stitches are all dissolvable but become tighter as they heal. To maintain hygiene, promote healing and reduce risk of infection, wash the perineal area regularly. Wash hands and change pads frequently. After a cesarean section, the midwife will check your wound daily. The dressing on your wound will be removed prior to discharge. Keep the wound clean and dry. A cesarean section is a major abdominal surgery. Do not lift, pull or drag anything for 6 weeks post-birth. You should check with your insurance company about when you can start driving again. We recommend all women take regular pain relief after birth. Be careful not to exceed the recommended amount. If your stitches or abdomen become very painful post-discharge, inform your GP or public health nurse. You are very fertile for the next 6 weeks. Return to sexual activity whenever you feel ready. Discuss contraception with your GP at your 6-week checkup. We recommend taking 1 iron tablet every day for 2 weeks post-birth. This is to replace iron stores lost during birth. Try to maintain a healthy diet and drink plenty of water. Try to rest when you can and don't be afraid to ask family and friends for help. Following discharge, if you are feeling unwell, have aches and pains, a sore throat, any foul smelling discharge or worsening pain, it is important to contact your GP or maternity unit as you may have an infection.
Hi, I'm Caroline, CNM 3 here in the maternity unit. After having your baby, your hands and feet can swell or become more swollen. This is normal and usually resolves in 1 to 2 weeks. Try to wear comfortable shoes and socks, avoid tight straps, rest your feet elevated. A DVT is a blood clot that can form in your leg. If it travels to your lungs, it can be dangerous. Your risk of DVT is increased for 6 weeks postnatal. Your risk is also increased if you have had a cesarean section. If your risk of DVT is increased, you will be advised to wear anti-clotting stockings for 6 weeks postnatal. You may also be prescribed an anti-clotting injection for 10 days to 6 weeks after having your baby. Your midwife will instruct you on how to administer this, and you will get a prescription on discharge. Symptoms of a DVT are pain in the calf or thigh, swelling, discoloration or hotness in any part of the leg. You may also feel shortness of breath or have chest pain. If you develop any of these symptoms, it is important you contact the maternity unit immediately.
Hi there, my name is Michelle and I'm a midwife at Portiuncula. Congratulations on your baby. Having a baby is an exciting and exhausting life-changing experience. It can be daunting and overwhelming. Baby blues are very common and normal and they begin around day 3. They're usually due to changes in hormones. You may feel more tearful and emotional than normal. You can feel helpless, isolated and lonely. These feelings can feel unpleasant, but fortunately they are short-lived and should last 1 to 2 weeks. You may be more at risk for feeling sad after you've had your baby if you felt down or depressed during or before your pregnancy. 10 to 15% of new mums can have postnatal depression. It can last months or years if left untreated. Your partner, family and friends may notice before you do. It's important to recognise your symptoms along with feeling sad, anxious and alone. You may feel irritable and angry. You may notice a loss in appetite, worried and feeling rejected. You may also experience a feeling of only you can care for your baby and you could end up pushing people away, including your partner. Some mums may experience panic attacks, and these are just some of the symptoms. Every mum is different and may experience different feelings and symptoms. The most important thing you can do is look for help, not to be afraid to look for help. There is many resources online, but talking will help. Talk to your partner, a family member or a friend. Your public health nurse and GP are there to help. Remember to enjoy your baby.
So now I'm going to take you through the 8 signs and symptoms and what to look out for. If one breast is significantly bigger than the other, if one breast drops lower than the other, so your nipples are not aligned, what we're looking on the nipple area is any inverted nipple, any discoloration around the nipple area, any fluid or blood coming from the nipple. Our obvious ones are our lumps, okay? So that we've lumps on the breast. Your main ones are your lumps. Any dimpling of the nipple area, any puckering of the skin, and then on our rashes, you're looking out for, it's like a pinprick mark, okay? So you can imagine a red pen dotted around the under part of your arm here, and you're looking out for like an orange peel. It feels like an orange peel rash also. You can imagine when you get your sore throat, your glands are sticking out. And underneath the armpit, if there's any swelling of the gland at all, that is also a sign of breast cancer. To finish this presentation, please take a moment to watch this clip on how to perform a self-examination.
Breast carcinoma, or breast cancer, is the most commonly occurring cancer in middle-aged women. The breasts are specialized accessory glands of the skin, consisting of ducts embedded in fatty tissue. Breast cancer can arise in the duct system anywhere from the nipple to the terminal lobule. Periodic breast self-exams are essential for early identification and treatment. The breast self-exam should be done regularly, every month immediately following the menstrual cycle. Step 1. Visual inspection. Look for any changes in the skin over the breast, like redness, swelling or puckering, and nipple changes, like discharge, scaling, or indentation. Step 2. Tactile inspection. There are 3 ways to physically examine the breasts. The circle method. Move the 3 middle fingers in a circular fashion starting from the outer edge of the breast towards the nipple. The line method. Move the 3 middle fingers starting from the underarm area down below the breast. Move slowly back upwards, repeating this until the entire breast is felt. Wedge method. Move the 3 middle fingers beginning at the outer edge towards the nipple. Repeat the procedure for every wedge until the entire breast is felt. Regardless of the method, the objective is to feel the entire breast and observe any abnormal changes. The breast should be soft and smooth to the touch. Pay special attention to check the underarm and upper chest areas.
Hi, I am Sheila, one of the lactation consultants here at Portiuncula University Hospital. I am here to support you and ensure you have the confidence, knowledge and skills to breastfeed your baby successfully. Breastfeeding is one of the greatest gifts you can give your baby. Your breast milk protects your baby against many illnesses and conditions. It is designed to meet your baby's every need. Your breast milk contains essential enzymes, hormones and antibodies. These are vital for your baby's normal growth, development and good health. While breastfeeding is the most natural way to feed your baby, it is a skill that you and your baby need to learn together. Breastfeeding takes patience and practice in the early days, but with the right help and support, you can start breastfeeding and continue for as long as you want to. You will soon learn your baby's early hunger cues. Eyes fluttering, moving their hands to their mouth, making mouth movements, moving towards your breast or turning their head when you touch their cheek. Crying is a late sign of hunger. Try feeding when you notice your baby giving you these early signs. It will often be easier as you'll both be calmer and more relaxed. There are many ways that you can position your baby to breastfeed. Whichever way is most comfortable for you is best. Correct position and attachment is the most important thing for successful breastfeeding and prevents many problems. Therefore, it is worth practicing to get it right from the beginning. Bring your baby close, tummy to mummy, facing the breast directly with their nose level with your nipple. Try and keep your baby's head and body in a straight line. Avoid holding the back of your baby's head. Their neck and body can be supported with your forearm. Gently brush your baby's top lip with your nipple. This should help them open their mouth wide. When your baby's mouth is open wide, quickly bring your baby to your breast with your nipple aimed at the roof of their mouth. The wider their mouth is open, the deeper the latch should be. When they attach, your nipple and most of the areola should be deep within the baby's mouth at the soft palate. And your baby's chin should be pressed into your breast. Your baby's cheek will appear fuller and you will start to see your baby suck and swallow rhythmically. If you need to detach your baby and reattach to change position, place a clean finger in the corner of your baby's mouth between the gum and break the suction and release your nipple. Breast milk is designed perfectly for your baby. Feeding frequently in the early days and weeks helps make sure that your baby is getting enough milk and that your body is making the right amount of milk. It is common for newborns to feed at least 8 to 12 times in a 24-hour period, including overnight. Feed your baby as often as they want. Offering both breasts at each feed ensures that your baby gets adequate milk volumes. The length of a breastfeed will be determined by your baby's interest and response. Offer the breast you finished with last on the feed following. Cluster feeding is normal. Newborns have periods where they may feed very frequently for a few hours, and these feeds are often followed by longer periods of sleep. These cluster feedings will often settle quickly over a day or two. If your baby is sleepy, you may need to wake them to feed to ensure they're getting enough milk. Everyone's breastfeeding journey is different, and we are here to help you and support you so that you can achieve your breastfeeding goals. Please ask your midwife for more information or contact us directly on 090 96 24 619.
Hi there, my name is Mary Cohen and I'm a chartered physiotherapist working in pelvic health and continence in Portiuncula University Hospital. Congratulations, I hope you will find this video helpful. The postnatal period can be both exciting and overwhelming. Your body has undergone much change in the past 9 months and continues to change in this, the 4th trimester. The birth of your baby, particularly if you've had a vaginal birth, is likely to have caused tissue trauma that takes time to repair, and this differs from woman to woman. With a cesarean section delivery, remember that you have had a major operation, so your body also needs time to recover and heal. It is common for women who give birth vaginally to have perineal and vaginal tears, most of which will heal normally within 6 weeks. Some things you can do to help your body recover are keeping your stitches and the surrounding area clean, using water warm from the shower hose or a peri bottle to gently clean the area and the perineum. It's important to rest whenever you can to allow swelling and wounds to heal, and sleep is crucial to healing and recovery, so avail of naps when you can. The use of ice using cold packs wrapped in muslin can help soothe swelling and discomfort, and supportive underwear may also help if you've had a C-section. Your posture is important in the postnatal period. When feeding your baby, try to ensure you have good back support using pillows or cushions to position your baby so you avoid slouching over too much. If you're bottle feeding, ensure you alternate sides so that your baby will turn its head to each side equally and that you are also using both sides equally, avoiding loading the same side all of the time. When lifting and carrying your baby, always ensure you avoid leaning over whenever possible. Bending your knees and tightening your abdominal muscles can help prevent back strain. Aim to use a sling or baby carrier rather than a car seat if you have to walk greater than 10 to 20 metres. Change your baby at an appropriate height where you're not crouching over, and kneel rather than bend over if you're changing your baby on a lower surface. Your bowel and bladder. Pay attention to your bowel and bladder habits. It's common to experience some changes in bladder and bowel function both in pregnancy and after childbirth, so it's important to address any issues early on. If you cannot feel the normal urge to empty your bladder, which can happen in response to bruising and swelling, it is important to go to the bathroom every 2 to 3 hours to avoid urinary retention and infection. Sit and relax to empty your bladder. Do not push the urine out. It may help to stand up and sit down again or lean forward. This is double voiding and can help to empty your bladder fully if you feel it's an issue. However, if symptoms persist beyond a few weeks, please seek help. Make sure also you avoid getting constipated or even allowing your stools to become too hard, as this can cause strain on your wound and the perineum and can cause urinary urgency. So using stool softeners and laxatives may help. Use a step to put your feet up so that your knees are higher than your hips, or even put your up on tippy toes can help. You can use a pad or toilet paper to support your perineum so when you're bearing down. Make sure you're drinking enough water, particularly if you're breastfeeding. Eat plenty of fruit and veg for fibre and avoid sugary foods. It's very important to remember to get back doing your pelvic floor exercises as soon as you feel up to it. These are important to help manage continence, sexual function and prevent pelvic organ prolapse. Remember, it's important to consider each of you individually, as it's not a one-size-fits-all. Consider getting an assessment if you've had issues in pregnancy or in previous pregnancies and delivery. In Portiuncula, a referral from your consultant, your GP or public health nurse is required to access the physiotherapy service. Online information is available on the PUH website, and there is a wide range of physiotherapy information available from the Irish Society of Chartered Physiotherapy. Thank you.
Wash and sterilize bottles for first year of baby's life. To make bottles, boil 1 liter of freshly drawn tap water. Leave this to cool for 30 minutes. Clean surfaces well and wash your hands. Pour the cold boiled water into a sterilized bottle. Add the formula using the scoop provided and following the instructions. "30 ml of water per scoop of powder, 1 ounce. Ensure the scoop of powder is a level scoop. Screw the teeth, put on the bottle's lid and roll to dissolve the powder. Cool the bottle under a cold tap. Check the temperature of the bottle on your wrist before you feed your baby. Throw away any feed not used after 2 hours. Your baby should increase bottle feeds gradually every day. At a week old, your baby should be taking 3 to 4 ounces or 90 to 120 ml of milk every 3 to 4 hours.
Hi, my name is Macy and I'm a midwife here in Postnatal Hospital. I'm going to show you how to bath your baby. Bath time is a chance for you and your baby to have fun, play and interact. A bath once or twice a week is enough to keep your baby clean. Firstly, make sure the room is warm. Gather everything you need before you start the bath. This includes towels, cotton wool, clean nappy and clothes. Fill the baby bath basin or sink until it has 8 to 10 centimetres of water in it. The water should be just high enough to cover your baby's tummy. Make sure the bath water is the right temperature, about 36 degrees Celsius. You can check this with your elbow. If it's too hot for your elbow, it's too hot for the baby. Undress the baby, leaving their nappy on and wrap them in a towel. Using the rugby hold, lift your baby over to the bath and clean their face and eyes using cotton balls, 1 for each eye. Hold your baby's head over the basin and wash their hair using only water. Dry your baby's head and then take off their nappy. Lift your baby into the water with one arm behind their shoulders and neck, holding their outside arm with your hand. Place your other hand under their bottom. Lower your baby slowly into the water so they do not feel as though they are falling. When their bottom is resting on the floor of the basin or bath, you can free that hand to wash them. Use your other hand to keep your baby's head out of the water. After you've bathed them, slip your free arm back under their bottom. Hold their legs with that arm as they will now be slippery. Then lift them out onto the towel. Pat them dry. Do not forget their skin folds and creases. Dress your baby. Empty the bath or sink.
Hi, I'm Amanda. I will be discussing a very important talk around safe sleep for your baby. Safe sleep practice is important to reduce and prevent the risk of sudden infant death syndrome. Babies have no concept of day or night, especially in the first few weeks of life, and tend to eat and sleep as part of their routine. Babies can sleep from 10 to 18 hours per day. As your baby gets older, their wakening periods increase and they will develop a pattern of sleep. The parent's bedroom is the safest environment for a baby to sleep in during the first 6 months. Babies should sleep on a firm, flat mattress in a cot. Keep the cot away from areas with drafts or radiators, as babies cannot control their own body temperature. A comfortable temperature for a bedroom for a baby is between 16 and 18 degrees. Avoid having any stuffed animals or toys in the cot. Babies should sleep on their backs with their feet at the bottom of the cot, and we recommend cellular blankets coming no further than the baby's chest, tucked loosely but securely. We do not recommend co-sleeping. However, if your baby does sleep in your bed, ensure they are on a hard, flat surface, keeping pillows and adult bedding away from your baby. Never sleep in the bed with your baby if you have consumed alcohol or any drugs. Remember to check your baby often to ensure that they are sleeping safely and comfortably.
Hi, my name is Paula. I am a senior paediatric physiotherapist working in the Portiuncula University Hospital. In this video, we will briefly discuss tummy time, plagiocephaly and torticollis. You may notice a flat spot developing on the side or back of your baby's head, and this is known as plagiocephaly. This happens because your baby's head is soft and can easily change shape. Your baby might prefer sleeping with their head turned to one direction, and you can reduce the incidence of flattening occurring by changing the baby's head position. Any head flattening should improve naturally as your baby gets older and the bones in their head gradually fuse together. Your baby's flattened head will not cause pressure on their brain or any developmental problems. If your baby has a mild case of plagiocephaly, they usually do not need to see a physiotherapist. The condition will usually improve if you follow the advice on the hse.ie website. Search for plagiocephaly or flat head and click the link Flat Head Syndrome in babies. Only babies with serious cases of plagiocephaly are referred to a physiotherapist. One reason for plagiocephaly emerging is if your baby has a torticollis. That's when they tilt their head down to one side or avoid turning their head in one direction. Take your baby to see your public health nurse or GP as soon as possible if you notice they have these symptoms. With the help of physiotherapy, most babies with torticollis get better through position changes and stretching exercises. Depending on the age of your baby, it may take weeks or months to fully correct. Tummy time helps to strengthen your baby's head, neck and back muscles and helps reduce the incidence of your baby developing a flat spot on their head. Your baby can begin tummy time from the day they are born. They can continue to do tummy time throughout their first year. More tips on how to do various forms of tummy time can be found on hse.ie and search for tummy time.
As a parent, your worst nightmare is finding your baby not breathing or blue. The following steps will show you how to administer CPR to a baby who is not breathing. Gently stimulate the baby by tapping or rubbing the baby's foot or gently squeezing the baby's hand. If the infant is unresponsive, call for help or call an ambulance, dialing 999 or 112. Lay the baby on a flat surface and tilt the baby's head back into a neutral position. Open the mouth and look for any obstruction. If there is an obstruction, remove it. Check for breathing by looking for chest movement, listening or feeling breath on your ear. Do so for no longer than 10 seconds. If baby is not breathing, cover the baby's nose and mouth with your mouth and give 5 rescue breaths. Ensure there is a good seal and that you can see the chest rise with the breaths. Each breath should last 1 second in duration. If there are no signs of life from the infant, then you will need to begin chest compressions. Place the tips of 2 fingers on the lower half of the breastbone, just below the nipple line, and push down firmly and fast to a depth of 4 centimeters. Give 30 compressions and give 2 more breaths, followed by 30 compressions. Continue this sequence until the baby responds or until the ambulance arrives and somebody is available to continue infant CPR.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.